like the plan that you're describing, if I understand it right, has some of the elements of single payer, but also some of the elements of medical savings accounts. It's not a sort of traditional, pure single payer plan. And you describe this as something that would never come from Congress. And so could you describe, again, this process by which, what kind of process are you talking about here?
I'm talking about using the national initiative. First, for this to happen, and I got to tell you, you're not going to have an alternative because 10 years from now, 15 years from now, you're going to have the problem getting worse. And they're all right about that. It's getting worse all the time. But don't worry about that. You think that that's going to cause you to solve the Congress to solve the problems? Look at this country. We're literally bankrupt. We're literally bankrupt, and nobody pays any attention to it. We've gone to these crazy wars. We have a nation that's controlled by the military-industrial complex that dictates what's happening to your lives, and the Americans are just whistling, walking through the cemetery. So I don't know if I've answered your question.
But this national initiative, how does that work?
How does it work?
It starts as a petition. It starts as what?
Well, I don't want to take the time to go through this whole process, but understand what I've done is I've copied the procedures that are used in the Congress and every legislative body in the world, and I've put them into a law called the National Ballot Initiative. And that is to equip every single Americans to become lawmakers, to come into the operation of government as lawmakers and partners with their elected officials. Now, this is revolutionary. This is out of the box. You know what it means? We trust the American people. Isn't that revolutionary? We trust the people. Rather, the other politicians say, trust me, I'll get elected and I'm going to do a job for you. I got news for you. Can't be done that way. And we have historic precedent to show it. And if that doesn't convince you that we're not going in the right direction, electing various personalities president and thinking that's going to make the change, I got to tell you, the change lies with you, not the leadership. The leadership has been screwing up by the numbers for the last 50 years. Have you had enough yet? Please.
Well, Senator, there was a question that I had in my mind about this, and it's addressed by one of our questioners in the audience. And interestingly enough, at this very moment, a question over email popped up that addressed the same issue. You describe these vouchers as addressing the specific conditions you have. You need a heart bypass, you get a voucher that could cover it. But Michelle in Iowa asked, how would you increase the role of prevention in the American healthcare system? And I'd in fact like to turn to Becky, and I apologize in advance if it's Estrella or Estrella, who's an RN at UHS Valley Hospital. Are you here, Becky?
I have been a nurse for 37 years, and I have seen patients come in to the hospital with medical problems that could have been prevented if a doctor had seen this patient early on. As president, how will you ensure that more access to preventative and wellness care is provided nationwide?
First off, there is a role for the president in his leadership capacity or her leadership capacity, and that is to change the culture, to really energize people to exercise. Now, people say at my age that, you know, I'm a good example. I've had 2 major operations, well, several major operations, but I'm in good shape because I exercise. I try to eat the right foods. And so I had a lady on a plane show me that she could have got this junk bar for 50 cents, but they were asking for $1.25 for the apple that she was holding up about to eat. Doesn't that tell you something about the dynamics of what's going on? I mean, we're all patriotic, whether it's in business, whether it's in labor, we're all patriotic. But we need a leadership that sets a tone to demand from us the best that's in us. And we recognize these problems. We know the problem of obesity. I try to diet all the time, sometimes successfully, sometimes not so successfully. But when all you got in your field of vision is junk food, you got a problem. And that's the problem that the president can bully. Now, you can say the government's going to regulate all this. I got to tell you, look what happened in Katrina. You know, you've heard the joke, I'm from the federal government, I'm here to help you. Well, that doesn't work. The government's a tool. The people can use it. But if the people have the direct power to use it, now you're going to see government as a real tool, not the tool you have where the special interests determine how the tool of government is handled by the lobbyists who do the bundling, to pay for the people who pay for their campaigns, to manipulate you to vote for them. That's the process that we live under, and that's a process that has to change.